Hello everybody, I hope this finds you well. I'm going to start off today by talking, as I normally do, about the data. Then I'm going to spend a bit of time talking about staff wellbeing. Then I'm also going to share with you some reflections on a session I did yesterday at Wishaw with a BBC camera crew around Project Search. And finally, I think I probably should congratulate Nina again on her MBE, so I'll do that at the end of the session today. So first of all, starting with the numbers, 150 new cases yesterday, so we are seeing the new cases climb again, and an increase of 5 in our inpatient cases. I think nearly all of those were on the Wishaw site. Wishaw has now swung back into Gold Command, because once they trigger 10 cases, that's when they swing back in, so they did that yesterday. What we are hoping though is that these cases will, these people, I shouldn't talk about them as cases, they're all people, will only be in hospital for a short period of time, and none of them at the moment are in ICU or needing CPAP, so that's positive. So we're not seeing as many cases translate into hospital admissions, but we are concerned about the numbers. In terms of vaccination, 448,000 doses, first doses administered, and 760,000 total doses across Lanarkshire now, so we're well on our way to getting everybody first and second dose administered, which is great news. I wanted to say a bit about staff wellbeing because along with that slight increase again around COVID, we're also seeing really high numbers of patients in our ED departments. Had over 700 on several occasions across the 3, and only a couple of years ago 500 would have been a high figure for a day of attendances in the 3 sites. So that is concerning, and we need to keep reminding people that there are other places that people can be seen, and we are doing again our communications around that. People do generally need to be seen, but what we're seeing is a high number of minor injury cases and a high number of really sick patients, and not much in between. So if you can reinforce these messages about, people can go to their pharmacist, they can go to optometrists and high street, make appointments there, etc., etc. It would be really helpful, because our staff can be a really helpful means of communication for us here in NHS Lanarkshire. So if you can get these messages out, it will help your colleagues at the front door. So if you can do that. The other thing we're going to look at is to see if we can do any tailored staff wellbeing work with the 3 EDs to try and support them, because it's been pretty relentless over the last few weeks. So I just wanted to say that. I wanted to share with you some facts and figures that the staff care specialists have given us from spiritual care team and staff wellbeing. So over the last few months, total number of colleagues who have had support from wellbeing facilities, either wellbeing centres, group sessions, or individual one-to-one support, or use the helpline, Teams or face-to-face. So during the month of May, 2,620 of those encounters took place. Back in March it was only 776, so these are increasingly being attended by our staff, which I'm sure you'll agree is really positive, and the feedback that we're getting is great. 39 people back in March attended wellbeing awareness sessions, but by the time we got to May that was 223, so again people are beginning to use the resources. And I think you need to be ready to access the resources. People are at different stages of dealing with the pandemic personally. So people need to be ready to hear the messages and engage, but when people are, please encourage them to come along, because it's really good if we can help people to deal with the issues that they have faced over the last year. So any support you can give us around that, really grateful. And also just to mention that there's a great new initiative starting at Monklands. In fact, I think it has already started at the end of May. We've got a project called Project Wingman at University Hospital Monklands, where a team of 9 flight crew from airlines will be providing a VIP lounge experience at the Wellbeing Centre in Monklands a few times each week. So I'd love to hear some feedback about that. In fact, I'd like to go and experience it. So I think that's actually already started, but I wanted to share that with you. Paul Graham was just letting me know about that a few weeks ago, and I did say I would put that out today. So people, please avail yourselves of the services of the VIP crew in Monklands and let me know how it goes. I just wanted to say a few words about Project Search. I was at Wishaw yesterday. Those of you that saw the BBC cameras might have been wondering what was going on. The BBC crew were interviewing a lot of people about Project Search, which you may know is a really innovative project that's been running now for 10 years in Lanarkshire. It involves North Lanarkshire Council as an employer, ourselves as an employer, and the college support through educational input. And it is a fantastic programme. I think we've had about 78 people through the programme now, and these are all people with a background of either autism or learning disabilities, and it provides a pathway to employment for these individuals, and the employment rates coming off the scheme, which is a year long, is about 2/3 of these people, sometimes more in some years, have got jobs. But the great thing is that having a job, as you know, gives you confidence, gives you self-esteem. Many of these people have got married, some to people on the programme. We've had 2 weddings, 3 babies, and a lot of these people now are living independently in their own homes following being through this programme. I think it's just such a fantastic programme, and I know a number of you have supported that. So this is a big shout out to all of you that have been mentors in the workplace and supported these individuals as they've gone through the programme. So I just wanted to say thank you for that, because it's many people have done that over a number of years, and I've seen these individuals when I've been out and about, and they just look so happy in their work and so proud of what they're doing. It's lovely. So finally, I just wanted to say a wee bit about Nina Mahal, our chair, who I told you last week will be leaving at the end of this month. And over the last week, it's timely, isn't it, that she's been awarded one of the Queen's Honours. So she is now Nina Mahal MBE. How fancy is that? And richly deserved. She's been our chair for the last 8 years and a non-executive member for several years before that. And I'm just hugely proud of her, and actually proud of the whole team, because her first response was that this is for the whole team. So thank you, Nina, and thank you to all of you again for everything that you do. Thanks.